at the Children's Hospital at Stanford.
What, if any, professional certifications have you received?
I have what's called board certification in adult and general psychiatry. I obtained that from the American Board of Psychiatry and Neurology in 1991. And then I obtained subspecialty board certification in child and adolescent psychiatry in 1993.
Are you a member of any professional organizations in the field of psychiatry?
Yes, I am. I'm a member of the American Academy of Child and Adolescent Psychiatry. I'm also a member of the Academy of Consultation Liaison Psychiatry.
How long have you been practicing psychiatry?
If you include my training in psychiatry residency in the US, that would be since 1985.
Is that approximately 35 years?
Yeah, I think so.
Okay. What percentage of your practice involves treating patients?
Yeah, approximately 3/4 of my time is working with patients. I work in the pediatric hospital, treating a combination of mainly children and adolescents with severe medical conditions, but also working with parents of children who have severe medical conditions. I also consult to the pediatric emergency room, and we evaluate patients who show up with suicide attempts and other serious situations.
What does the remaining quarter of your practice entail?
Well, as a professor, I have to do a number of academic activities. So I do research, I do a lot of teaching, I give lectures, I supervise residents, medical students, and fellows in psychiatry. I do some administrative work. Yeah, so it's a pretty diverse, varied day and week.
Can you tell the jury a little bit about your research and academic work?
Yeah, a lot of my research has involved looking at the issue of trauma and PTSD in parents who have medically fragile children. A lot of these parents are naturally really affected by their child's illness and develop trauma symptoms. So I've developed some interventions to try to help parents, provide support and treatment to reduce their symptoms of trauma.
Have you published articles or books in your area of expertise?
Yes, I have. I've published approximately 70 or probably closer to 80 peer-reviewed manuscripts in different scientific journals. I've also published a number of book chapters on various topics, approximately 30. And I have published 3 textbooks, one of which has gone into a second edition on topics that are related to my area of expertise. And one of them actually is about the treatment of PTSD in parents of premature infants.
Have you published a book through the APA?
Actually, all of those books were published through the APA, the American Psychiatric Association. They have a publishing house, and that's been my publishing company.
What is the APA?
The APA, the American Psychiatric Association, not to be confused with the American Psychological Association, is a professional organization that represents psychiatrists in the US. The last time I looked at this, I think there's about 37 or 38,000 members. And the APA has many different roles. One of it is advocacy in psychiatry in the US, but it also has an important role in terms of education. So they host an annual scientific meeting every year in which psychiatrists will present their research. It publishes a number of journals in the field, and fairly frequently it publishes guidelines for professional practice or about ethical guidelines that they hope that the members will follow as part of their practice.
What ways are you involved with the APA?
Well, I mentioned my publishing. I also present at the scientific meetings. I last presented in 2021 during COVID. It was virtually, but on the topic of group therapy for parents with trauma symptoms. I follow the APA and their various guidelines. I think it's a really influential and important institution.
Going back to your credentials, what, if any, professional awards have you received?
I've been given several teaching awards at Stanford University, and the American Academy of Child and Adolescent Psychiatry that I mentioned honored me with an award for service to my specialty several years ago. I don't remember exactly when.
Have you given any public presentations in the field of psychiatry?
Yes, that's part of our work as an academic psychiatrist, is to lecture, to give presentations. So I present fairly frequently at annual scientific meetings, as I mentioned. I've been invited to give grand round presentations at different medical centers, including University of Pennsylvania and Harvard. So that's just part of our role is to try to educate our colleagues about our work.
Have you testified as an expert in the field of psychiatry before?
Yes, I have.
On how many occasions?
I would estimate, in terms of deposition and trial testimony, approximately 50 times in the past 15, 20 years.
What type of cases did you testify as an expert in?
They're pretty varied. So some of them have been medical malpractice. I've also done a number of cases evaluating victims who've been subject to physical or sexual assault or trauma.
What work were you asked to do in this case?
My role in this case was to give my opinions about the testimony and opinions of Dr. Spiegel, whom you heard from yesterday morning.
And what work have you done to form your opinion?
I was present yesterday in court listening to his testimony. I have viewed his depositions. He had 2 depositions earlier this year, and I watched those depositions. I've also read a lot of deposition testimony. For example, testimony by Mr. Depp psychiatrist, Dr. Blaustein, by his physician, Dr. Kipper, and nurse Debbie Lloyd. I've reviewed depositions by many of the therapists involved in this case, including Dr. Banks, the relationship consultant, Dr. Cohen, who was Ms. Heard's therapist, and I think Dr. Anderson, who I think provided some couples therapy. I've also reviewed the medical records of Dr. Kipper and Dr. Blaustein, and some various email communications. I think a lot of the information that has been talked about here.
Thank you. Your Honor, at this time, we'd like to offer Dr. Shaw as an expert in the field of psychiatry.
Any objection?
We approach.
Okay. All right. So any objection?
No objection, Your Honor.
All right, so he'll be moved as an expert. Thank you.
Dr. Shaw, you testified that you observed Dr. Spiegel's testimony yesterday.
Yes, that's correct.
And to reorient the jury, can you please generally describe the main areas in which Dr. Spiegel testified?
Yes, he.
Objection, Your Honor. They heard what he testified to. What's his opinion?
All right.
Foundation to reorient them?
That's okay. We can move forward.
Okay. Do you have an opinion of Dr. Spiegel's testimony?
Yes, I do.
And what is your opinion?
I have a couple of primary opinions. The first is that my opinion is that he violated the ethical principles that are outlined in the Goldwater Rule when he gave his opinions about Mr. Depp, specifically with relationship to personality traits and his cognitive abilities. My second primary opinion would be that that Dr. Spiegel's opinions were unreliable and that he had insufficient information.
Objection, Your Honor.
All right. You're going to approach?
Yeah. Dr. Shaw, you mentioned the Goldwater Rule. What led up to the publication of the Goldwater Rule?
The Goldwater Rule came about in response to an incident that occurred during the 1964 presidential election when Senator Barry Goldwater was running as a Republican candidate. And there was a magazine called Fact Magazine that started a campaign to discredit Senator Goldwater. And they obtained a mailing list from the AMA and sent out a single survey questionnaire to about 12,000 psychiatrists in the US, asking if they felt that Senator Goldwater was fit to run for office. And about 2,000 psychiatrists responded, 1,000 of whom expressed very negative opinions about Senator Goldwater and made comments such as, for example, he was a megalomaniac, he was a paranoid schizophrenic, that he had narcissistic personality disorder. And as a result of that, he was replaced as a candidate and then went on to sue Fact Magazine for defamation of character. And he was successful in that lawsuit. And in response to this incident, the American Psychiatric Association, that I think was really concerned about how psychiatry was being represented and statements psychiatrists were making about someone they had never met or evaluated, issued the Goldwater Rule. And the main premise of the Goldwater Rule was that it was improper for a psychiatrist to render a professional opinion about a public figure unless they had personally and closely evaluated them.
What justifications did the APA provide, other than the ones you mentioned, for enacting the Goldwater Rule?
They wanted to make sure that psychiatric illness wasn't being stigmatized. They wanted to ensure that individuals weren't defamed by statements made by a psychiatrist that weren't backed up by medical evidence. And they also wanted to preserve the integrity of the psychiatric profession, since I think the public in general, when a psychiatrist speaks out publicly and expresses an opinion, a psychiatric opinion, people generally like to take that seriously, and the APA wanted to make sure that those opinions were credible and could be relied upon.
Have there been any updates to the Goldwater Rule?
Yeah, since 1973, which is when the Goldwater Rule first came out, there have been a number of revisions and publications by the APA. They're called Annotations in Psychiatry, in which the Goldwater Rule has been better defined and expanded to some degree. So, for example, in 2017, in this publication, the APA reasserted that it was not ethical to provide a psychiatric or professional opinion about someone who had not been evaluated personally by that psychiatrist, that it was unethical to provide an evaluation without obtaining consent from that individual. They also sort of really kind of defined what a professional opinion is, and how they defined it is that an opinion that a psychiatrist expresses about someone's speech, behavior, or any characteristic about that person, if that opinion is made using the expertise, experience, and knowledge inherent in the practice of psychiatry, that is considered a professional opinion. So it might include making a diagnosis or not making a diagnosis. And the other, I think, a couple of important things about that 2017 document were that the APA specified that if a psychiatrist is to give an opinion about someone, about the diagnosis or personality characteristics, whatever, that they have to follow an appropriate methodology. They have to do an evaluation that follows the standard practice of a psychiatrist here in the US. And if they don't do that, they are considered to be, affecting the integrity of both the psychiatrist and the psychiatric profession. And this revision of the Goldwater rule definitely received a lot of support. The president of the APA at the time stated that breaking the Goldwater rule was irresponsible, stigmatizing, and definitely unethical. So that was a very strong statement from the president of the APA.
What other medical organizations have weighed in on this issue?
Yeah, the number of organizations have their own sort of version of the Goldwater rule. The American Medical Association, that represents physicians in the US, has an annual meeting, and they have what's called a Council of Ethical and Judicial Affairs, and they had a meeting in 2017 in Honolulu, and they came up with their own statement about the issue of whether physicians can provide opinions without directly evaluating somebody. And their opinion was that physicians should refrain from giving a psychiatric diagnosis about any public figure, including celebrities and people in the media.
Are there exceptions to the Goldwater rule?
There are exceptions, yeah. And I think Dr. Spiegel had a lot to say about this yesterday when he was saying that if you couldn't express an opinion without evaluating someone, it sort of made the whole specialty of or role of experts in the court sort of null and void. But there are exceptions and situations in which an expert can give testimony in court. So one good example would be if there was a medical malpractice case, or if there was a case that involved a patient who'd committed suicide and the courts wanted to find out whether the psychiatrist had followed appropriate practice. The expert can review medical records and can give an opinion based on those records, provided those records have sufficient information, for example, about the diagnoses, about the treatment, about how the patient was responding or not responding to treatment.
Did you form an opinion about whether Dr. Spiegel complied with the Goldwater rule?
Well, my opinion is that he did not. He expressed a number of professional opinions about Mr. Depp that we heard about yesterday. And again, he did so without an evaluation, without consent. He did not follow the guidelines of the APA in the 2017 revision, where it was considered important that there be sufficient information obtained by that expert to give an opinion. So I would definitely felt that his conduct, unfortunately, did violate the Goldwater rule.
And specifically, what opinions of that Dr. Spiegel gave yesterday do you feel violated the Goldwater rule?
Yeah, I think that, well, there were sort of two primary ones. The first that you heard about was that Dr. Spiegel had professional opinions about Mr. Depp's personality. And he talked a lot about how he believed that Mr. Depp had narcissistic personality traits. So, and he also, talked a lot about narcissistic personality disorder. So, narcissistic personality disorder is a diagnosis in the Diagnostic and Statistical Manual. It's called the DSM-5 for short. It's a diagnostic manual published by the APA.
Objection, Your Honor. Can we break for a moment?
Okay.
Go ahead, Dr. Shaw, please continue.
Sure. So I was just talking about narcissistic personality disorder in the DSM-5. So the diagnostic criteria for that are, I'm not going to remember every word about this, but essentially it's a pattern of grandiosity, a need for admiration, a lack of empathy that's demonstrated by that person since young adulthood. And the DSM-5 has 9 specific criteria, and for someone to meet the diagnosis, you have to meet 5 of those criteria. And so when, as a psychiatrist, we're trying to make a diagnosis of any personality disorder or any diagnosis in general, the normal professional guidelines would dictate that we would do a very careful diagnostic interview. And there are actually interviews specifically written to assess personality disorders. It's also possible to have the individual fill out questionnaires. There's something called the Narcissistic Personality Inventory. This is a 40-item checklist that taps into various components of narcissistic personality disorder. And it's also possible to get psychological testing, like the MMPI that I think you heard about in reference to one of the other experts here. So with all of this information, including collateral information from family members, work colleagues, information of that sort, it is possible to come up with a diagnosis of narcissistic personality disorder. So in the case of Dr. Spiegel, he had none of this information, even though he came out and stated with what he described as a degree of medical certainty that Mr. Depp had narcissistic personality traits. And if you remember somewhat towards the end of his testimony yesterday, he was asked to, since he couldn't provide any documentation from the medical record about narcissistic personality disorder or narcissistic personality traits, he was asked about what is referred to a lot in his testimony as record evidence. So information that he obtained from depositions, from text messages, from emails, whatever. And so he was asked to give, I think, 5 examples of record evidence that would make it seem like Mr. Depp met criteria for narcissistic personality traits. And I'll just mention a couple of them, just to illustrate my opinion, is that testimony did not really hold together. So he stated, for example, that one of the criteria for narcissism is narcissistic personality disorder is a sense of entitlement. And the example Dr. Spiegel gave is that he believed that Miss Heard married him for his money. So clearly, sense of entitlement is from a psychiatry perspective, that's very different from a belief that someone wanted you for your money. A second example that was given was that he was asked to give an example of how Mr. Depp had shown that he was envious of others, which is another criterion for narcissistic personality disorder. And the example that Dr. Spiegel gave is that Mr. Depp was jealous of Miss Heard because he believed she was having an affair with Mr. Franco. Now, if we look at these two terms as a psychiatrist, there's a big difference between being envious and being jealous. As a psychiatrist, when I think about envy, I think about somebody wants something that someone else has, and it makes them feel
Objection, Your
bad.
Honor. I think this is going beyond his
All right.
investigation.
He's giving his opinion as to how Dr. Spiegel violated the Goldwater rule with respect to his testimony about narcissistic personality traits.
He did, but now sustain the objection. Next question.
Okay. Okay, and you mentioned 2 major examples. What was the second one?
The second one was confusing being envious with being jealous.
Oh, sorry, Dr. Shaw. I mean, You mentioned two major examples of ways Dr. Spiegel violated the Goldwater rule. What is the second?
Oh, sure. So the other big category had to do with Dr. Spiegel's evaluation of Mr. Depp's cognitive abilities. And his general opinion was that Mr. Depp had deficits in his memory, in his attention, in his processing speed, that he had word-finding difficulties. Again, Dr. Spiegel did not evaluate Mr. Depp, and the information that he relied upon, there were two pieces of information. The first was that he watched a very long deposition that Mr. Depp gave the day after I think he had flown back from London to the East Coast. And he made observations about Mr. Depp's behavior in that deposition, and felt that he could opine or give an opinion about processing speed and other cognitive aspects. He also made reference to something you heard about yesterday, this thing called the mini mental status examination. This is a brief screen for memory and cognitive functioning that is often done. And he testified that Dr. Blaustein had administered the mini mental status examination. And although, from the records, all we know is that...
Objection, Your Honor. I'll sustain the objection.
Dr. Shaw, without going into Dr. Blaustein's record, what information does a mini mental exam provide?
Objection, Your Honor. It's beyond the scope of his designation.
Overruled as to that limited question.
Mm-hmm. Yeah, so the mini mental status is, it's a series of about 10 or 11 questions and tasks that someone completes, and you get a score out of 30. What Dr. Spiegel testified was that Mr. Depp could not recall 3 words after 5 minutes. And he used that as an example of Mr. Depp having cognitive deficits that he specifically attributed to Mr. Depp's alcohol and substance abuse. And he really did not have sufficient information. I liken a mini mental status exam, it's like taking someone's temperature. If it's elevated...
Objection, Your Honor. I think it's gone beyond designation.
I'll sustain the objection.
Okay. Now it's probably a good time for a break.
Okay, sure. All right, ladies and gentlemen, I know you had a break, but we didn't. So we're going to go ahead and take our afternoon break for 15 minutes. Do not discuss the case and do not do any outside research, okay? You can stay right there, Doctor.